Welcome to Pennsylvania in Focus. I'm Eliana Kernodle. Reinstating work requirements for welfare got some support from both sides of the aisle this week. Joining me to tell us more about this is the Center Square's Pennsylvania editor, Kristen Smith. Kristen, what has been the debate in the past and what's kind of happening now?
So just a quick refresher, because, it is about reinstating work requirements. Those were first implemented under the Clinton administration in the 90s. And what the point there was, it was to help encourage people to enter the workforce and stay in it and therefore no longer need the benefits. That was kind of the basis of it. But states have applied for waivers on and off for decades, and Pennsylvania has been one of them for the last 25 years. And there's been different reasons for that. COVID was a big one. There was a Medicaid expansion. There has, I think, and even a lot of people would argue there were bipartisan reasons to do that. But ultimately speaking, Republicans have been of the mind that we need to return in some way to that welfare to work requirement that the Clinton administration had implemented. Democrats have been a lot less welcoming of that idea. They believe that our economic policies just make it too difficult for people to both work and, not have their social safety net that they are needing. They also say that these work requirements are going to, disproportionately hurt people. Now, what's important to know about the work requirements is that they would only apply to able-bodied adults with no dependents. That's in Pennsylvania. I believe that's roughly 2 million on food stamps 200,000 on food stamps. And the Medicaid number is slightly higher, but right around in there. And that is meant to make sure that the people who have disabilities, who have children, who have other extenuating circumstances that either make work really hard or make it so that even working a job would not cover their daily living, they're meant to be kept in the safety net. And in fact, there should be more resources for them because of it. What Democrats worry about with that is that there are, able-bodied adults are a very hard group to serve as far as welfare goes and services go, because they don't have a very obvious disability doesn't mean that they don't have mental health conditions that make it very hard for them to work or other problems that don't fall under the category of disability. And that's kind of been the fundamental divide for the last several years. But this week, we've had a very interesting development in that there's two bipartisan bills that were introduced that deal with this issue. And one of those bills would require 20 hours of work or community service or training for able-bodied adults who are on Medicaid. The idea here is that they don't do that, then they're no longer eligible for Medicaid benefits. Representative Frank Burns, who represents a district out in Western Pennsylvania, just south of Pittsburgh, he is a Democrat, and he says that this, again, is reminiscent of the welfare to work program that was implemented back in the 90s. And the idea really is to meet in the middle, to save on costs, and so that more resources can go to people with disabilities and children and in those other categories. But also it will help people get off that government dependency sooner, which has been a major criticism from the Republican Party. Then there's a pilot program that would apply to counties with populations between 90,000 and 250,000. And this pilot program would focus on the Temporary Assistance for Needy Families program, which is a cash benefit program. And what this pilot would do is help able-bodied adults with no children and no disabilities. It would allow them to slowly taper off of their cash benefits as they continue to work more and more hours. So for the first 6 months, they would work 20 hours and keep all their benefits. Second 6 months, they would work 30 hours a week, but only keep 70% of their benefits. And then by the end of the year, the idea is that they're working full time and they no longer need the benefits. Again, this is a pilot program, another bipartisan proposal that Frank Burns sponsored. They're both in the House Human Services Committee, so they're waiting for further action. But truly, it is an interesting development as far as this conversation crossing the aisle.
Well, Kristen, thank you for your insights on this story. It'll be interesting to see as it continues through the process where this debate goes. And you can follow this and more at thecentersquare.com.